Welcome to the podcast, The Patient's Voice. Does it matter? This is a place where your voice will always matter to me. Healthcare is complicated, so I wanted to create a safe space where we will discuss tips, hot topics, provide resources, have guest speakers who are experts in the healthcare industry, or real patients sharing their patient experience in hopes to help you navigate any healthcare setting. I want to focus on you, the patient, and discuss issues that matter to you in an open and transparent way. I'm your host, Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board-certified patient advocate. I have a passion for patients. Let's be the change together. So welcome back, friends. We're going to talk about something today that can be stressful and even a little scary for patients, and that's being discharged from the hospital too soon. Have you ever felt that you weren't ready to go home, but you were discharged anyway? You're not alone. In this episode, I will explain why this happens, what you can do about it, and how to advocate for your own health. Imagine being discharged from the hospital only to find yourself back in the ER within a few days. I see this happen way too often, and it shouldn't, and it's extremely frustrating. So let's dive in. As always, I'm going to start the show with a "What would you do" segment. Then we will transition into "Let's talk about it," and finally wrap up the show where I provide you tips and how to make your voice matter in this situation. Let's get started with "What would you do?" I have a client that was in the hospital due to UTI, sepsis, and congestive heart failure. He was in the bed for 2 weeks recovering from his UTI and sepsis. The doctor wanted to put the patient on oxygen for him to take home, and that's something that the family or this patient had never done, is oxygen at home. He needed durable medical equipment, and since the patient had not been out of the bed for several weeks, physical therapy wanted the patient to get up, go to the bathroom on his own, and walk in the halls. So the healthcare team and the family came up with a treatment plan. The very next day, the family got a call from the hospital that the hospitalist decided to discharge the patient immediately without even discussing it with anybody. The family was upset, called me, and because we knew the patient was not ready to be discharged and that our treatment plan that we had discussed the day earlier was being dismissed. So what would you do? Now it's time for the "Let's talk about it" segment. So why are patients sometimes discharged from the hospital before they feel ready? Well, here are a few factors. There's pressure on hospitals to free up beds due to high patient volumes, and there's no bed availability. And that's why there's a problem right now going on in our country called emergency room boarding, which I'm going to talk about in an upcoming show. Insurance companies and cost-saving policies often encourage patients to have shorter stays. And there's also staffing shortages, which limit the availability to provide adequate post-discharge monitoring. All of this can lead to patients being discharged before they completely feel better. Studies show that up to 25% of patients are readmitted within 30 days of discharge. Now, I do want to be clear on something. Many times hospitals believe that patients will recover better at home, because being at home means less exposure to infections and more rest with all the nurses, having the nursing staff come in and the beeping. And hospitals recognize that's a key part of your healing process. What are some signs you might be discharged too early? And how would you know if you're being discharged too early? Here are several things to keep in mind. If you have uncontrolled symptoms like significant pain, vomiting, are having other strong symptoms, it might not be the right time to leave. If you have unanswered questions, if you still don't understand your condition, your treatment plan, or what medications to take, that's a red flag. You should not be discharged. And your inability to perform basic tasks. If you're unable to walk, eat, or take care of yourself, it may be too soon to go home. Like I mentioned in the example earlier about the patient who had been in his bed for 2 weeks and couldn't walk. Some patients need more time to stabilize. Some examples: patients recovering from surgery may develop infections after discharge, or your infection is not cleared up. I had a patient that we begged the hospital not to discharge her, as she had a UTI that turned into sepsis while she was in the hospital. They did not listen to the family, and they discharged this patient anyway. She had to be readmitted back into the hospital 3 days later due to sepsis complications. And this infuriates me. It's when the patients are dismissed by the healthcare system and they think they know best. I hate to say it, but you have to fight for your patient safety. But remember, you're fighting for your health and your life. Patients that leave before they fully understand their medications, as I said earlier, this is a huge issue. Sometimes there's lack of follow-up care because not all patients have follow-up appointments arranged. They should help you arrange any follow-up visits to your doctors before you're discharged. And some of them don't even know the next steps. So if you're not clear on that, don't be discharged. And then there's an issue with home health services. It's a huge issue and it drives me crazy. If you're going to require home health services, like you've got to go to a skilled rehab or something, I think that a case manager or social worker should speak to you the minute you're put in your room, not the day of your discharge. If you are ever feeling unsure, speak up. This is your health, and you have the right to ask questions, and you have the right to refuse to be discharged before you are medically ready. There are consequences for early discharge, and some of those consequences are you could have medical complications, you could get infections, relapse of symptoms, and worsening of your chronic conditions. Your patient experience, emotional stress for patients and caregivers. You're feeling abandoned or unsure about managing your condition at home. And there's financial burdens. There's additional costs for being readmitted and new treatments. Families have to bear the cost for transportation, care, and missed work. And did you know that hospitals face penalties from Medicare and insurers for frequent readmissions? And sometimes you're not financially responsible if that happens, and I'm going to go into that in a minute. So these are some of the consequences that fall on you as the patient if you are discharged too early. Now, what do you do if you are unready and if you feel you're being sent home too early? Well, here's some things you can do. Communicate clearly. Tell your doctor or nurse exactly how you feel and why you think you're not ready to leave. You've got to be specific about your symptoms or concerns. Again, I said this earlier, you've got to speak up. Ask for more information. Make sure you understand what happens once you leave. Do you have your follow-up care arranged? Can you call someone if your symptoms get worse? What's the plan if things go wrong? You can always request a second opinion, and I've done this a lot. You can ask for another doctor to review your case, and this is especially helpful if you feel something's being overlooked. Know your patient rights. Every patient has the right to refuse discharge if they believe it is not safe. Hospitals cannot force you out without discussing alternatives, like transferring you to a different level of care, such as a rehabilitation center. Just remember, you've got to speak up if you feel you're being discharged too soon. So how do you plan for a safe discharge? Even if you do leave the hospital, make sure you have a solid plan in place. Like caregiver support. Is there someone who can help you at home? Especially if you're weak and are in need of assistance. Medication and follow-up. Do you have your prescriptions? Do you understand how to take them? When to take them? When's your next doctor's appointment? Do you have an emergency plan? What should you do if something goes wrong after you're home? Who do you call? Where do you go? Make sure you have a very clear idea of how to handle any complications that may arise. Now I want to shift the conversation. So the hospital's talking about discharging you. You tell them you do not think you're medically ready, but they do it anyway. You go home, and a week later, you're back in the emergency room being readmitted in the hospital with the same condition. Who is financially responsible? Now, whether you're responsible for paying for a hospital readmission due to being discharged too soon depends on several factors, including your health insurance coverage, the reason for your readmission, and specific policies of the hospital and your insurer. Here's what I'm talking about in a more detailed explanation. So, health insurance. If you have private insurance and you're readmitted, you might have to pay again, even if the readmission is for the same condition. But it's always something that you can fight about it. But if you have Medicare, if you're readmitted within the same benefit period, you typically won't have to pay the deductible again. Now, when it comes to hospital and insurance policies, so hospitals get penalized for being readmitted, you being readmitted to the hospital within 30 days of the same condition. And Medicare penalizes these hospitals, not the patient. And they do it for excessive readmissions within 30 days for certain conditions under the Hospital Readmissions Reduction Program. This means that hospitals may get reduced payments from Medicare, but it does not affect the patient at all. If you want to appeal these charges for being readmitted, if you are having to pay for these, you can appeal it if you believe you're discharged too soon. You can file a grievance with the hospital's patient advocate department if you feel your discharge is what led you to that readmission. To be completely honest, I have never seen reaching out to the patient advocate hospital grievance. Never mattered, in my opinion. It's never worked. I'm hoping that will change eventually, but right now I think it's just a waste of time. But do know that's an option. You can file a grievance against the hospital. Contact your insurer. Reach out to your insurance company and explain the situation, because they could review your case to determine if those charges can be adjusted. If you're on Medicare, you have the right to request a review of your discharge discussion, and it's called the long name is called the Beneficiary and Family Centered Care Quality Improvement Organization. In certain areas, it's called your QIO. Here in Alabama, we call KEPRO or something. I'll link some resources, but you can file that before leaving the hospital. My candid opinion about the QIO process is that all the years that I've had my clients file for a review, it's gotten us nowhere until recently. I'm starting to now see that if you file this, they can put an extension on your discharge. So please always try to file that. It's worth the try. And like I said, I will link that. It's through the BF. They have all these acronyms. I think it's the BFCC-QIO, but I do know it's the QIO. And there's legal considerations. Hospitals are required to provide care that meets the standard of medical necessity. If there is a premature discharge and it doesn't meet the standard, there are grounds to dispute those charges. Or consult a professional for personalized advice, like reaching out to a patient advocate who can provide guidance based off of your certain circumstance. You know, as an advocate, I work with my clients in the healthcare system. And like I said, I see this all the time. And usually when I work with the system and the insurance, I've had great success in getting bills absorbed due to these preventable readmissions. So just know that if you're readmitted, there could be cost accrued to you, but there are ways that you can dispute it and fight for it, because don't pay a bill that you don't deserve to pay. Now we've come to the final segment, and that's let's talk about how to make your voice matter. Remember the scenario at the beginning of the podcast with the patient who was not ready to be discharged? Luckily, in this situation, the hospitalist listened to our concerns. The patient had not received his wheelchair or walker from the durable medical equipment company. The patient's oxygen tank had not been delivered, nor the family been trained on how to use the oxygen. The patient was not able to go to the bathroom or walk as recommended by the physical therapist, and the patient's infection had not cleared. This patient remained in the hospital for an additional week. We had to fight to get the system to listen to our serious concerns, and I'm glad that we fought, because this patient was able to stay in the hospital, get the medical care they needed. They were safely discharged and did not have to be readmitted into the hospital. So to wrap things up, being discharged from the hospital, it can be a positive step to recovery, but it's important that it happens at the right time, your time. If you're unsure or worried, speak up and ask questions. You have the right to feel comfortable and safe before leaving. Premature hospital discharges can lead to serious harm for patients, including medical complications, financial burdens, and emotional stress. Healthcare providers, insurers, and policymakers need to prioritize patient safety over cost cutting. I'm going to say that again. Healthcare providers, insurers, and policymakers need to prioritize patient safety over cost cutting, because ensuring patients receive care for the right duration can save lives, and it actually can reduce healthcare costs in the long run. Remember, your health is in your hands, and being an active participant in your care can make all the difference. Thanks for listening, and take care of yourself. That brings us to the end of this episode. I hope this topic was beneficial to you. As always, thanks for listening. And until next time, take care of yourselves and each other. Make sure you check out the resources in the show notes. And if you enjoyed this show, please follow, rate, and review me on Apple Podcasts, Spotify, Google Podcast, and my YouTube channel. Also, please reach out to me if you or your loved one needs private help in navigating the healthcare system. Until then, this is Krista Hughes. And don't forget, I have a passion for patients. Let's be the change together.